Sarah, welcome. So much to unpack. How did I not know how important the pelvic floor was or what it even is? So I'm so glad you're here.
Thanks for having me, Michelle.
Well, you wrote in your book, which I will hold up, called Floored. You wrote that medical gaslighting is more likely to happen to women than to men. More moms are dying in the first year after childbirth in the United States than any other developed country in the world. Currently, 20 states in the US have a tampon tax, which taxes menstrual products such as non essential luxury goods, while Viagra, a well known prescription erectile function drug for men, is not taxed in any state except for one. So we as women are literally penalized and often dismissed for having vaginas. So you wrote that. And I was like, I want my audience to hear that because I didn't know some of those stats. And then later in the book, you write nearly 1 in 3 women suffers from a pelvic floor disorder, from painful sex to prolapse, back pain to constipation, and urinary leakage to lack of orgasms. Although pelvic floor issues are common, they are not normal. I wanted my audience to hear that too. But most of us aren't taught what the pelvic floor actually is, let alone how to care for it. I completely agree. Until I read
Mhm.
your book, I didn't know any of this stuff. So
Yeah.
tell us why you wrote this book. And yeah, maybe you can unpack some of the stats that I read.
I have been a pelvic floor physical therapist for over 18 years, and I jumped right into this field after getting my doctorate in PT. And I didn't have pelvic floor problems, but I really loved learning about my own body as a woman and helping other people. I treat all genders, but women in particular that are going through so many transformations in their life, whether it's becoming sexually active, getting their period, pregnancy, birth, menopause.
Function drug for men is not taxed in any state except for one. So we as women are literally penalized and often dismissed for having vaginas. So you wrote that. And I was like, I want my audience to hear that because I didn't know some of those stats. And then later in the book, you write nearly 1 in 3 women suffers from a pelvic floor disorder, from painful sex to prolapse, back pain to constipation, and urinary leakage to lack of orgasms. Although pelvic floor issues are common, they are not normal. I wanted my audience to hear that too. But most of us aren't taught what the pelvic floor actually is, let alone how to care for it. I completely agree. Until I read
Mhm.
your book, I didn't know any of this stuff. So
Yeah.
tell us why you wrote this book. And yeah, maybe you can unpack some of the stats that I read.
I have been a pelvic floor physical therapist for over 18 years, and I jumped right into this field after getting my doctorate in PT. And I didn't have pelvic floor problems, but I really loved learning about my own body as a woman and helping other people. I treat all genders, but women in particular that are going through so many transformations in their life, whether it's becoming sexually active, getting their period, pregnancy, birth, menopause, and their bodies and their pelvic floors are transforming, yet they are given no guidance on how to actually navigate these changes. So, over, the almost 2 decades of my career, I have worked with thousands of women, and their stories are so powerful, but I still hear so many women saying, why didn't anybody tell me this sooner? Why didn't my doctor tell me that pelvic floor therapy was an option? I feel like I wish I would have known this 10 years ago. And then again, people still feeling very alone, even though these situations, these symptoms are very common, but we're told that they're normal. And again, as you said, they're not normal, they're just common.
Yeah. And that's why I'm so glad you're on today because I read your book twice. I told you that before we started recording. And every time I was just reading some of this stuff, I'm like, why don't we know this? I didn't know that there was such a thing as a pelvic floor therapist, other than 2 years ago, I had a urological surgeon on who said that pelvic floor therapists are the unsung heroes. And I sort of made a note, but I never thought to myself, well, maybe I should go see one.
Yeah, yeah. Because you don't even know what that is. Like,
No.
you don't know like what is the pelvic floor? What does therapy look like? Are you in a gym doing exercises with everybody? Is it like a gynecological exam? It's very mystical. And so
Right.
I think it really starts with understanding that this part of our body even exists. What does it do? How can we proactively care for it? Because our medical system is very reactive. Like you have to have a problem and then try to treat it. And then if you are experiencing a problem, that there's hope and there's help and there's a really effective form of treatment called physical therapy that can help alleviate a lot of your symptoms.
Absolutely. Well, let's also start there. Please explain to my audience what the pelvic floor is and how it works.
So your pelvic floor is a group of muscles that sit at the bottom of your pelvis. So if you imagine that bony ring that you see on skeletons, at the bottom there's an opening, but that opening is actually covered by a basket of muscles called your pelvic floor. So it's like the floor of your pelvis, the floor of your core. These muscles attach from the tailbone to the pubic bone and side to side. So they really sit like a hammock. Your organs rest inside of that hammock. So your uterus, your ovaries, your bladder and bowels. And so this muscle supports those organs. And then you also have openings in the muscle where urine exits through the urinary sphincter, where bowel movements exit through the anal sphincter, and then the vaginal opening for vaginal menstruation, intercourse, and birth. So you've got openings in this muscle to keep things in, to let things out. But then this muscle is also working like every time you lift weights, when you breathe, when you pee, you poop, you birth. And but again, we don't often know that something's wrong with it until we have a problem, or that it even exists until you have a problem, like leakage of urine, or difficulty holding in bowel movements, or prolapse when that hammock isn't supporting your organs as well, or even sexual pain or difficulty having orgasms. These are muscular issues, but we're not looking at evaluating the muscles as the source of the problem.
Wow. Okay. So much I want to cover there. And it's so funny because I just crossed my legs and I read your book and I know I shouldn't do that. I should
Crossing your
cross
legs
them
is,
by the ankles,
I
right?
know, if you have pelvic floor tension, then I would say crossing your legs could be a good change to make. But for most people, like crossing your legs every once in a while is fine. But, maybe just switch sides left to right occasionally.
Because what are we doing? Putting tension? Is this the idea? Is this
It,
like
it
so much of what we're doing? Go ahead, please.
Yeah, a lot of the things we do throughout the day can cause tight muscles in one area or the other. So when you kind of roll your knees in, you'll see people kind of rolling their thighs in and their ankles point out, or crossing your legs and twisting them up like a pretzel. It can cause some tension or tightness in your pelvic floor muscle. So it's not going to always lead to a pelvic floor issue, but if you're having a pelvic floor issue, an easy change to make is look at how you're sitting, which we all do for hours a day now, and think about, okay, can I just cross my legs at the ankle? Can I unclench my tush and not squeeze my tush so tight? Can I, turn to the right side instead of always turning to the left side? So just small changes to make that can just help give your tissue some movement instead of being in a stuck tight state.
Yes, and I'm uncrossing my legs right now because I want to be relaxed. I'm curious, even like I know we're supposed to be sitting in the back of the chair. I bought a chair because it was pretty. It's not functional or comfortable.
Same, same. I get it.
I every time I sit in this chair to do these interviews, I'm like, oh, I got to get a new chair. If you have any recommendations, you can give us some on that. So you mentioned a few different pelvic floor issues just as we were talking, and you have also said a couple times now that we often don't even know that we have them. So I think it'd be helpful for my audience to learn like what are the common symptoms of some of these pelvic floor issues, what might be triggering them, and then who do we see? Because if we're going to go to the doctor and they're going to say it's normal, I don't want to go to them.
Right. So we'll break it down by kind of what this your muscles do, and then
Please.
how do you know if you're having an issue. So
Yes.
these muscles help keep in urine and stool, and then when you go to the bathroom to relax, you should empty your bladder and you should empty your bowels. They should relax for vaginal intercourse, insertion of vaginal or menstrual hygiene products like tampons and menstrual cups and things like that. And they should support your pelvic organs. So kind of keep those organs supported when you lift something or exercise or things like that. When these muscles aren't working well, there's one of two things that can happen. The muscles can be weak, which is what we often think of when we think of the pelvic floor.
Yeah.
So when the muscle's weak, those sphincters that help hold in urine and stool aren't keeping them in as well as they should. So you'll
Mm.
leak urine with a cough or a sneeze, or have some fecal staining, or urgency to get to the bathroom in time to have a bowel movement. So those sphincters aren't as strong as we need them to be because of weakness. And
Okay.
you can also have what's called pelvic organ prolapse, which is when that hammock of muscles isn't supporting your organs as well, and they start to push into the vaginal walls. And it feels like something's falling out of your vagina. There's a bulge at the opening of your vagina. You have pressure or heaviness or back pain. And actually, the majority of people who have given birth vaginally, have some degree of pelvic organ prolapse. But we don't give moms the opportunity to strengthen after birth or strengthen during menopause. So this prolapse starts to get worse with aging.
Mm.
The other thing that can happen to muscles, if it's not weakness, it's actually tension. And when these muscles get tight or tense, think about when you get tension in your neck or shoulders and it gives you a headache or you feel like you need a massage. The same thing can happen to your pelvic floor. And with your pelvic floor muscles, you'll experience, if they have tension, a hard time starting your urine stream. You feel like you'll have to push or strain to get it started. You may have straining during bowel movements or hemorrhoids or fissures. You may have painful intercourse, so insertional pain with intercourse or deeper pain that feels like your partner's hitting something, or the inability to use tampons or menstrual cups or have a pelvic examination, or even just tailbone pain or vaginal vulvar pain with sitting. So I always say, like, no amount of leakage or pain is normal. It's information from our bodies that something's not working the way that it should be. But yet, unfortunately, we're often told, like, oh, after having babies, like leakage is normal, or with aging, sex might be painful because you're dry. And again, these are not normal experiences, and we need to help women know how to treat them instead of just kind of saying, oh, this is just going to happen. And then our quality of life is impaired. So, how to treat them, you really have to kind of first determine whether you have tension or whether you have weakness, because we've always been told, like, do your Kegels. Well, that's great if you have weakness, but if not, if you have tension. So, I actually have a quiz on my website. My website's thevaginawhisperer.com, but there's a quiz on there that you can take that asks you a bunch of questions about, like, which category do you fall in? And then that helps guide your treatment of, do I need to work on relaxing my muscles because they're too tense or strengthening my muscles because they're too weak?
Okay. What if you checked off stuff in both lists,
Yeah.
like me?
Typically, and that's me too. If you check off things in both lists, you typically treat the tension first.
So you don't do the Kegels?
You don't do the Kegels until the muscles are kind of back to a more restored resting length. So you want to, because doing Kegels like tightens and shortens your muscle, right? So you
Yeah.
want to kind of work on changing your posture, doing some breathing exercises, maybe a little yoga, or get some massage to the hips or even internally to the pelvic floor to relax the muscles. And then you start strengthening. The reason is because if the muscle's tight, just kind of shortening and tightening a tense muscle isn't going to give you strength. It's just going to give you more tension. But it is a little bit about balance. So when you start strengthening, you kind of need to make sure that you're relaxing your muscles afterwards and still folding in some breathing and stretching. It's all about balance. And I think, unfortunately, oftentimes we only work on like only tightening the muscles or only doing relaxation when we need to be focused on both.
Okay. And you mentioned that the pelvic floor is the floor of our core. So if we
Right.
are doing exercises that are strengthening our core, are we also, as a byproduct, strengthening our pelvic floor, or no, not unless we intentionally work on it?
A little bit of both. So,
Okay.
if you're ideally when you are doing core workouts, you have these deep abdominal muscles called your transverse abs that co-contract with your pelvic floor. So we
Okay.
always think of your core as your abs, but it's really your pelvic floor, your deep back muscles, your diaphragm. It's all like a big Coke canister in there. So yes, you can be activating your pelvic floor when you're working your core. However, if you have dysfunction, which a lot of people do, your pelvic floor is not turning on the way it should be. And then
Mm.
you're just like working on your core, but not getting the benefit to your pelvic floor. And there have been studies that shown that if your pelvic floor turns on after your abs versus before, you typically can tend to have pelvic floor issues. So it's one of the things that we work with women because they're like, I've been doing Pilates and I'm still leaking, or
Mm.
I've been doing my Kegel exercise device at home, but like it's not working. It's such a small muscle. It's a very subtle contraction, but sometimes we're overdoing it or we're just not timing it right, where we just need a little bit of like fine tuning. It's like a vagina personal trainer to get in there and just kind of coach you a little bit, and then it starts clicking and you get the benefit of what you're looking for.
Yeah. And so basically, seek out help.
I am a huge fan of one-on-one therapy, and the I have an app that has pelvic floor workouts. The book is out. People do telehealth. Nothing is going to replace one-on-one care. However, not everyone is able to access that.
Yeah. Yeah. And you have the V Hive too.
Yeah, so the VHive is my online, pelvic floor app that has workouts for strengthening and relaxation at home. Some patients do that in conjunction with therapy, but some people, like, you don't have access to a therapist in your area. The
Yeah.
waiting list can be long. There's just
Mm.
not enough of us in the country to see the, you know, tens of thousands of women that are giving birth every year, the millions of women going through menopause. So it's one of those things where we just want to give people options for how they can access pelvic floor health care.
Absolutely. And I have a feeling that the doctors are recommending care once there's already a problem and maybe
Correct.
one that's gone too long. So, why is it important to address these issues early?
So, because they don't get better with time.
Yeah.
The research is very clear that if you're experiencing, say, painful sex or urinary leakage or even back pain 3 months after giving birth, you're likely still going to be experiencing it at 12 months postpartum. So when you
Mm,
see your doctor and you complain about these things, which is takes a lot of courage to even bring up, and
yes.
then they say, "Oh, give it more time." Time isn't going to necessarily improve those symptoms. If anything, it could get worse once you go back to work and exercise or have another baby. And so it's really important for early intervention, whether it's recovering from a prolapse surgery after giving birth, whether you're in perimenopause and your tissues are changing and your hormones. You want to kind of always try to be proactive in your rehab and recovery. Just like if you had like an ACL knee surgery, you wouldn't just be
Yeah.
like, okay, go home and get back to running and tell me how it feels. It's like, no, you really coach that person and train them to get back to function. And that's what we really need for women to have at different ages and stages of life as well for their pelvic floor.
Absolutely. Well, let's go through some of the things because you said that one out of two of us will experience
Yeah,
incontinence in our lifetime. That's half.
I
So,
know.
and you say that it will limit our ability to socialize, exercise, have sex, make us feel bad. So, just talk to us more about urinary leakage, anything we can do to prevent. And if you have it, can you reverse it? Can you make it?
Yeah.
You can.
You can improve it. I mean, I will never guarantee someone like, we'll get you dry or we'll get you out of pain, but there are definitely things you can do to improve it and prevent it from getting worse.
Okay. Or
And this,
prevent it let's start like maybe even just prevention. Let's say somebody
yeah,
doesn't have
yeah.
that.
So there are some risk factors that make people become more incontinent versus continent. Some of it is multiple vaginal births. So having three or more vaginal births, pushing for a prolonged period of time during their birth. There's a genetic component to it as well. Like if you have a family member who has, prolapse or incontinence, you may be more at risk. There are some kind of autoimmune and genetic disorders.
Oh
So
wow.
there are some risk factors, but I would say the biggest thing is our everyday things that we're doing. So when you are peeing, don't push when you pee, right?
Why? Tell us why we
I
shouldn't and
know.
why do we? I mean, I've had you in my head and you've said I'm not the only person who's told you this. Ever since I read your book, I'm like, oh my God, Sarah says don't do this. So
Yeah.
why do we push? Because
So
sometimes we feel like we need to.
exactly, because we want to be efficient and
Yeah.
fast, and we're always in a hurry to get to the next thing.
And just to make sure nothing's left.
Correct. But when you are pushing, when you pee, two things happen. One, you're actually tensing your muscles instead of relaxing them. And that can actually lead to incomplete bladder emptying, which makes you feel like you have to go a pee again soon after.
So it does the opposite of what we think we're doing.
Correct, because you're actually tightening
Interesting.
your muscles when you're straining. The other thing is it can weaken, the pressure can kind of weaken the bladder support. So, like your bladder has ligaments that kind of attach it up. And then when you're pushing and straining, that kind of pushes the bladder down and can weaken that support over time, which can lead to prolapse and weakness and then leakage later. So, like when you pee, sit, chill, and just breathe. And like your bladder is actually a muscle that will push the urine out for you. So you don't have to push. So that's one thing. The other thing is having really good bowel movements, not straining with bowel movements. Again, chronic straining with bowel movements can weaken your pelvic floor. I think a common misconception is that only people who have given birth will have pelvic floor problems. When we see women of all ages, I mean, if you have constipation, it often starts in childhood or, when you're taking a medication, and these things can start very young. You're having a movement every day or every other day, and you're straining, and that can weaken your pelvic floor over time. And then the other thing is that, again, that point about balance. If you're doing a lot of strengthening, you also need to work on relaxation. If you only do relaxation, you want to make sure that you're also doing some proactive strengthening. So knowing kind of how to, activate these muscles and things like that are important. I would say that during pregnancy is another key time because most women become incontinent if they have incontinence, a lot of times it pops up during pregnancy. Go see a pelvic floor therapist or use the guidelines in my book or on my app for pregnancy because your body is changing, your pelvic floor is stretching, and that stretch means you can't support your bladder and your bowels as well. So we see a lot of leakage starting to happen during pregnancy. And the doc says, wait till after birth to deal with it, but it doesn't get better after birth, right? Because then you push for hours, you had a C-section, you have a perineal scar, and your muscles are affected. So get help sooner than later. And then the other thing I would say is after birth, every mom should be seeing a therapist or working on a program for pelvic floor strengthening after birth and cesarean rehab. And then another big time frame is during perimenopause and menopause, postmenopause, I should say, that one of the biggest factors that affects our pelvic floor strength and integrity is decreased estrogen. We have estrogen receptors in our vulva and vagina, and when estrogen levels are decreasing, we don't have those. We have less thickness and plumpness to our vaginal tissues. We have more dryness. We have less collagen, and collagen kind of gives you support to the muscles and organs. So everything's weaker and atrophying and dry. And so using topical estrogen during perimenopause and then definitely postmenopause, in addition to strength training, is a great way to really keep those muscles and tissues as plump and healthy as possible.
So vaginal estrogen.
I'm a huge fan.
I was going to say you're a huge fan. That's so good to know. Um, you wrote something in the book that I'm going to touch upon because it's kind of ties into what you're saying. First, it's true, I never thought about it, but the baby gets like 8 visits at least in the first year. They're like, come back in 6 weeks to the mom. And
Yeah.
in the book you wrote, I met a mom of twins whose husband broke his finger and he was, I'm going to laugh. It's not funny. Sorry.
It's sad, but true.
It made me so angry. Okay. You wrote, I met a mom of twins whose husband broke his finger and he was prescribed 12 weeks of physical therapy, 3 sessions of hand therapy for 3 months. While after the birth of her twins, which was an emergency C-section, cesarean section, she was sent home with an ice pack, some ibuprofen, and 2 newborn babies, and to follow up with her doctor in 6 weeks, while pelvic rehab and physical therapy are not yet the standard of care after giving birth. Because so
Makes no sense.
when I just stopped when I read that, I'm like, yes and no. So, first of all, women are remarkable, like everything we're talking about and how much we carry. And the reasons I think we don't even know stuff's going on is so we've got the mental load and the physical load and all the things we're doing, and we're got plates spinning left and right. And so things are happening and we put ourselves off. And so, this is an invitation to say, please don't,
Yeah.
because things can get worse. And then your quality of life is going to be impaired, right?
Yeah. Yes.
Yes.
And I'm always like, yes. And I think it's absolutely moms deserve better care. I mean, women
Yes.
deserve better
And the
care.
system should be supporting us.
That's what it is. It's like the
Right.
system does not support us. I mean, 40% of women, of postpartum moms, do not attend their postpartum visit. And it's because we have to be back at work because we don't have paid leave. We don't have childcare. We have other kids that we have to care for. 25% of women go back to work within 2 weeks of giving birth.
It's amazing
It's
when you think about
awful.
it. It's horrible, but it's
I mean, you're
amazing about the
still
capacity women have.
It is, and we've kind of endured it because we've had no choice. And
Yeah,
so I
you're
think
right.
it's very easy for us to say we can handle this, everybody before us did, but I'm like, but we also deserve better. And it's also easy to say like, well, I should have done this, but I'm like, no, the systems aren't set up to help us succeed, to help us recover, to help us re-strengthen. You don't have a partner who's got paternity leave so that you can leave and go to an exercise class or get some sleep or go for a walk. I mean, the systems are not set up to support us. So it's hard to be like it's on the mom. But unfortunately, right now, we do have to kind of say, like, I deserve this. I need this. And I need to start taking the steps to advocate for myself because the system is not doing it for me.
Absolutely. And part of that is just education and knowledge, which is
Yeah.
what this your book is, what this conversation is. Just even knowing, like, you wrote that pelvic floor dysfunction is related to back pain, breathing challenges, jaw clenching, and foot pain.
Yeah.
Who's going to make that connection? Like, what is the connection with the back and the jaw? Well, the back I get now based on what you talked about. Why the jaw?
So there's actually these layers, these kind of fascial layers in our system. And the way I describe fascia is like, sorry to all the vegetarians out there and vegans, but if you eat chicken, right, you've got the meat and then you've got this skin, and then between the skin and the meat, there's just like this white slippery layer, right? That kind of helps the skin glide. That's fascia. And fascia helps our tissues and muscles glide and move. But when that fascia gets really stuck, which can happen with tension or posture or clenching, it doesn't allow our muscles and tissues to soften and move. And there are fascial layers that go from our neck and our jaw all the way down to our pelvis and then down to our feet. And so there are these kind of deeper layers of tissues that if it's stuck somewhere, it doesn't allow something else to move. And we
Mm.
actually hear this a lot with moms who've had abdominal surgeries and C-sections because they've got this kind of cesarean shelf or this stuck C-section scar, but they're like, gosh, I have all this shoulder pain. I'm like, well, because one side of your abs are stuck, which is like rotating one side forward, and then you've got this neck stuff here. So it's all these kind of weird connections that we as specialists in anatomy and physiology, we can put those pieces together.
Mm.
But if you're seeing a shoulder doctor and then you're not seeing anybody to help with your C-section scar, it's like those pieces just aren't put together. Or if you're seeing somebody for your back pain, they're not asking you about urinary leakage, right? So it's just there are connections here that we need doctors and specialists for the bladder, the bowels, the uterus, the joints, but we also need the people like therapists, physical therapists who can put those connections together to say, okay, what's really going on here? Let me look at all the different puzzle pieces and how can I put this together to really help this patient?
And if you went to a pelvic floor therapist and said, I've got tension in my jaw, I'm clenching all the time, I had a C-section, will they make that connection? Will,
What we'll do is an evaluation. We'll say, okay, let's look at how your spine is moving. Let's look at, if we release if we do some breathing techniques in yoga, are you able to relax your jaw better? Like do some sympathetic down training. If we, kind of looking at different things of like, okay, this is what we're finding. You have
Mm.
pelvic floor tension. Not everybody who clenches their jaw is going to um, had pelvic floor tension, but like if you start wearing a mouth guard, do you feel like your muscles are more relaxed throughout your body because you're not clenching up here kind of thing?
Yeah, it's all of it's so fascinating. And it's also interesting. You told the story of a woman who had had a C-section like decades earlier, and you did some work on her, and it helped her so much. And it made me remember because I had an emergency C-section, wasn't my daughter was breech, so she was preemie, the whole thing. And I remember I don't barely remember that first appointment with my gynecologist, my OBGYN. But then later I had a regular appointment with my doctor and I said, it feels like something's still stuck. Like I feel like they left an instrument inside me. And she looked at me sideways and I'm like, I know that there's probably nothing in there, but it doesn't feel right.
Yeah.
And then I just ignored it, but it stayed like that for a year. So I'm saying
Wow.
this is why the system
Yeah.
does, like you're right, there should be more curiosity or hey, why don't we just send you to a pelvic floor therapist?
Right.
Like that would have been a perfect opportunity to
Right.
say, hey, I
And
doubt you
then
have it. Yeah, go ahead,
And then
please.
we evaluate you. And if people come into like, there's no negative side effects of getting a pelvic floor therapy assessment or evaluation. I'm really confused about why it's not better integrated into our healthcare system for pregnancy and postpartum and perimenopause and postmenopause because there's no negative side effects, right? It's kind of like going to the dentist. Like you can kind of figure out like, oh, do they have a cavity? Or are they doing well? And they just need to keep up their routine. Like we should be supporting women in this same way because we know their body is changing. We know their pelvic health is changing. I
Yeah.
also think that women know their bodies best, but we've been told for so long, don't worry about it. This is normal. It should be fine. I don't know what the answer is. But to your point about curiosity, I'm like, I may not have all the answers, but I want to help you find somebody who can get you the answers. And that's really hard in our healthcare system. But we have to encourage moms and women to keep advocating for themselves. And I think we as providers need to ask the questions so that we can get patients the resources that they need.
Yeah. And especially with moms, because you are tending to your newborn. And I only have one daughter. So I'm always the first time mom, right? I never went through it a second time and have any sort of thing to memories or experiences to look towards, look back at and say, oh, yeah, that's normal or that's not. And so we do need the system helping the moms. In an ideal world, when somebody's thinking about getting pregnant, like what would be the sequence of events that would be happening, Sarah, that would support a mom? Like, let's say there's some younger women listening. ideally, let's get to them first so that, they don't maybe have to go through some of the things that those of us who are older and didn't know this stuff
Yeah. I mean,
didn't
even
do.
when you're in the trying to conceive phase, I'm like, that's a great time to see a pelvic floor therapist before your body has even changed. Like, what does your baseline look like? And then getting an examination, which includes an internal vaginal assessment of the pelvic floor muscle. So a lot of people don't know that a pelvic floor examination can include that. It doesn't have to. It can be mostly external, but the way that we evaluate the pelvic floor muscles are either through the vagina or the anal opening, but normally through the vagina if a patient consents. And then we're like, are there things you need to work on? Anything you need to tweak? And then during pregnancy, right away you're kind of hit with progesterone changes, which can cause constipation or, maybe vomiting, which can cause leakage. So it's like, how are we coaching patients through those experiencing saying, hey, if this happens, this is how you poop. If you're leaking when you vomit, put a ball between your knees and squeeze it, like things like that. And so helping them support them through every stage of pregnancy. And then I'm a huge advocate of seeing a pelvic floor therapist during pregnancy. In the first and second trimesters, we want to be focused more on strengthening and pain management, hip pain, back pain, sciatica. And the
Mm.
third trimester, focus more on birth preparation for regardless of what type of birth you have. So if it's a vaginal birth, teaching someone how to push, how to breathe, how to keep the hips and pelvis relaxed. If it's a C-section, working on tissue mobility, on, core rehab for afterwards, things that they're going to need to know, everything from like how to pick up your baby to how to get out of bed to how to take your first poop. Like those are the pain points of postpartum that nobody talks about. And then definitely seeing someone kind of postpartum as well. So at 6 weeks, if not earlier, and then ongoing when you return to exercise and sex and work. So really having these touch points, just like we do for babies, but really doing it for moms as well.
The women, the moms need so much more support than they're getting. There's no denying that. All right, so let's do a simple. So, how many times a day should we be peeing? Is there like a baseline?
I
Like,
love it. So a normal frequency to pee is 2 to 4 hours a day, and then 0 to 2 times at night. So you want to try to stay within those ranges. So if you're going
yeah,
too frequently, like every
yes.
30 minutes to an hour, or just in case every time you leave the house, or if you're holding it for too long, like all day when you're working or in meetings, that's like not good habit. So between 2 to 4 hours during the day, and then 0 to 2 times at night.
Okay, perfect. And for constipation, what do you recommend? Like, even if it's stuff you're doing every day because of
Yeah, it is stuff
19
I'm
years
doing
of
every
practice,
day.
what should we
You
be doing?
you've got to stay hydrated. I mean, have your emotional support water bottle with you. We're all probably overhydrating, but I'm like, your pee should come out like light lemonade color, like
Okay.
almost clear, a little yellow, but you don't want to overhydrate, but it shouldn't be dark. The other thing is that, I'm huge on getting fiber. So people don't even know, like, what is that? I'm like, fruits, veggies, whole grains, less processed foods, but also even taking psyllium husk or which can help kind of soften your stool. But you have to take that with hydration as well. Movement is key. So there are studies that show that 30 minutes of walking actually helps increase digestion. And then actually how you poop. So using a little stool or a squatty potty underneath your feet, that puts you in more of a squatting position when your feet are elevated while you're sitting on the toilet. And then when you're bearing down to poop, don't hold your breath. Again, that can tighten your muscles. Exhale like you're blowing out birthday candles. And that technique can help like relax your pelvic floor muscles. It's like unkink the hose to get the poop out.
Okay. And let's talk about prolapse because I don't think anyone wants to experience that. Tell us the stats on how many women do. And there's different kinds. So anything we can do to be preventative. And if you do have mild prolapse, you said a lot of women who've had vaginal births
Yeah.
might have that. Anything they can do to keep it so it doesn't ever get too bad.
Yeah. So my tips for prolapse, it can be a prolapse bladder, uterus, cervix, balls, is you have to stop straining. So you could do Kegels till the cows come home, but if you're still straining, whether it's straining when you're lifting weights, like you're holding your breath when you're lifting, whether you're straining with bowel movements because they're too hard, whether you're pushing when you pee. You may have a job where you're like doing a lot of heavy lifting and you're not engaging your core and pelvic floor muscles properly. So stopping straining is key.
Okay.
The second thing is start strengthening. You can have a little bit of tension. Some people have tension when they have prolapse. If you don't have tension, then you can start strengthening because these muscles are endurance muscles. So you can't just do like quick Kegels when you're in the carpool lane. You need to really do longer hold endurance Kegels, holding for 5 or 10 seconds, do them in different positions, like
Mm.
not just sitting, but do them in standing, doing with lifting weights, doing with walking, doing, leaning against the wall, doing wall sits or planks. Use the muscles when you need them and work on the endurance portion of the muscle. And the last thing is get support, which means you can use an internal vaginal support like a
Oh,
pessary or a tampon, or an external support like there's like underwear that kind of have like vulvar support that kind of give you a little pressure up. So getting support will help you feel more comfortable, have less pressure, and become more active without being so symptomatic.
okay. But you can't reverse it if you have mild.
Actually, there are studies to show that you can reverse it 1 grade. So there's a way that we grade prolapse from 1 to 4.
Mm.
So if you're a 1 or a 2, which means the organs are not protruding far past the vaginal opening, that's typically a candidate for therapy first or a pessary. If you have what's called a grade 3 or 4, you'll typically be a surgical candidate, but you still want to utilize those strategies like not straining, starting to strengthen, again, maybe using a topical estrogen cream to help plump up the tissues. So those different things can help maintain a surgery that has to happen, but also you can improve it with exercise and lifestyle management and supports.
Okay, let's talk about exercise. So you mentioned lifting and doing it the right way. So I had a guest on recently who was talking about the importance of lifting heavy. So we want to build strong muscle and bones, but we don't also want to create a prolapse issue or some other issue. So what in your view, what should we be doing to stay physically active, build those strong muscles, but take care of our pelvic health at the same time?
Yeah, I think the kind of lowest hanging fruit is like if you start experiencing symptoms, you're probably pushing your tissues and muscles past the threshold of what they can handle. So if you have leakage with jumping or a jumping rope or heavy lifting, your pelvic floor muscles can't quite support what you're asking it to lift. And so you need to back down a little bit, or insert a pessary or bladder support or something like that. The other thing is mechanics. Like, are you rounding your back instead of keeping a nice neutral spine? Are you holding your breath instead of exhaling and breathing out? Kind of looking at how you're lifting and the mechanics of what you're doing can make a big difference. And you do want to build muscle. I mean, women and moms are not porcelain dolls. You can absolutely push them, but I think we also have to do it in a very strategic way to say, okay, you pre-pregnancy, you were, squatting 75 pounds, so let's get back to that. I'm like, no, you need to rebuild the deep core and pelvic floor muscles and then start loading the muscles gradually over time.
Okay, that's perfect. And also, maybe this is when you should also be going to see a pelvic floor therapist
I
to just say,
know, for
right, just to
sure.
see where you're at too, because
Yeah.
maybe what if you're feeling like pressure or stuff, but it's not prolapse? Like, is that the
I
beginning
go
stages?
for it. I mean, I think normally you can't always tell that you have prolapse until it kind of reaches like the outer
Goes low.
third, yeah, the lower third of the vagina. That's where there's sensory receptors that start feeling like, oh, something's rubbing, or it feels like something's in there. And that gives you a sense of like, okay, some tissue's hanging low. And that's typically how some people find their prolapse for the first time. And that's what I would say, go get it checked out. It's just like if you had back pain, you're like, okay, I could watch a YouTube video and do a bunch of crunches, or I could actually get a specialist to look at how I'm moving and sitting and breathing and
Yeah.
what's weak or what's strong and get a more individualized approach.
Yeah, because you don't want to be building strong muscles and bones and creating more issues. Like you have to work it. Yeah.
Yeah. And I think that the other thing when we get these recommendations, and I love how much attention menopause and perimenopause are getting right now. But I don't think we're talking about enough about the pelvic floor and the changes that it's experiencing during those life stages. Because you can tell somebody you need a jump rope for a minute a day, or you need to do this many squats, or you need to walk with a weighted vest for this long. But I'm like, if you're leaking when you're doing that, you can't do that. And
Yeah.
so we're not addressing the people who have real issues preventing them from doing it, and you're giving us these recommendations, but they're like, okay, well, is it okay to do that if I'm like urine's leak dripping down my leg, or if my vagina feels heavy, or it's causing more back pain? I think there's a little more nuance to these recommendations that are needed than just like lift heavy and, you know, keep lifting weights kind of thing.
Absolutely. And that's why I'm so glad that you're on, because when I read your book, I was like, oh, wait, this is an important piece that nobody's talking
Our
about.
vaginas.
Literally, literally. Okay. So um, let's give some actionable tips. What are some of your top tips for women that they can do right now to start taking care of their pelvic floor?
So some of them we've already mentioned,
Yep.
and there. This is kind of in the back of my book, which was one of my favorite things of like, what do I do for my pelvic floor every day as
Yes.
a
What
pelvic
do
floor
you do,
therapist?
Sarah?
I know.
I want to
I,
know.
I don't push when I pee. I do not
Ever. And you don't
ever.
hover at the airport when you're using the
Oh,
public bathroom.
I
And
hover not at the airport, but occasionally I will hover. Like we just went to
yeah.
Europe and there were like some really funky bathrooms and like a park. And I was like, you know what? This is not a toilet that I'm sitting on. Or we were actually on a road trip and there was no bathroom around and I was peeing in the woods. I'm like, okay, I'm hovering for sure. But there, I even have like techniques on how to do that. But I don't push when I pee and I sit
Yeah.
down. As a standard, I sit down to pee. Like, I hover occasionally, but I don't as a standard squat over the toilet.
Right.
And I don't go pee just in case. Like I go pee when I have the urge to pee.
This is one because we got in the habit with our kids. Okay, did you go before we
Yeah.
leave? And then
Yeah.
we would start going
Right,
too,
right. And then
right?
when you get to the next place, you go again. And then before you leave the place, you go again. So you want to pee when you have the urge to pee. So those are kind of my main peeing tips. Um, for pooping, I use a squatty potty every time I poop. Every bathroom in my house has one. If I go stay at a friend's house and they don't have one, I'm like, Amazon Prime, it needs to be here in 2 days. Like, you need to have a squatty potty. My kids have one in their bathroom. Elevating your feet relaxes your muscles in your
Yeah.
pelvic floor and it just makes it easier to not strain. And I take magnesium citrate every night to help soften my stool. I mean, I don't
Mm-hmm.
get enough water, I don't get enough exercise. I'm not doing all the things in those capacities, so I need something to help keep my stool soft. I exercise very regularly, and when I do my workouts, I activate my pelvic floor in those workouts. Like if I'm doing a squat, I pre-contract my pelvic floor. If I'm doing a bicep curl, I pre-contract my pelvic floor. Eventually, you don't need to do that and it becomes automatic. But when you're
Yeah.
starting to do this training, when you have dysfunction, it's a great place to start like using the muscle when you need it and or getting your pelvic floor workout integrated into a workout you're already doing. So it's not like you have to have like a separate Kegel regimen. I use a good lubricant. I think, back in my 20s, it used to be like, oh God, she needs a lube. She's not aroused enough. But, postpartum, perimenopausal, you have vaginal dryness, and that is like part of our bodies. But I want to have good sex. And so I use a vaginal lubricant. For intercourse, I use a water-based one. And then I also use a vulva moisturizing balm, which certain times of my cycle, or particularly when I was postpartum and breastfeeding as well, I had vaginal dryness from low estrogen. And so I use a moisturizing balm by a company called Medicine Mama. And it's organic, it's all natural, and it's just kind of like a hydrator, just like I put on my face, but I put it on my vulva and vagina. And then I also use a topical estrogen cream proactively. I started in my 40s, and then will do it till I die.
And do you like the tube versus the inserts?
I actually use the cream. I don't
The
use the
cream,
tube.
that's what I meant.
I
Sorry.
put it
When
on
I
my
said the tube of
right, but
cream
they
is what
give
I
you
meant.
like a little plunger to put it in with, but they give you one, and you've got to use it twice a week, and that's just not for me. So I put it on my finger, and I insert it into the vagina and kind of wipe it around, and then at the opening, and then I also do like vulva mirror checks, which people are like, "You do what?" But if you don't know what your normal is, you don't know like, are my labia the same size? Is my urethra the same size? Is my vaginal opening the same? Like, are there color changes? You kind of have to know what your normal is on these
Mm.
tissues so that if there are changes, like my labia look like they're resorbing. Well, that can be due to low estrogen, or there's some fraying of tissue at the vaginal opening. That can also be due to low estrogen, or, the tissue around my clitoris isn't moving back as well. That can be something called clitoral phimosis that has to be treated. So there are things that we need to kind of know about our body. And I always say, like, more people, more partners and physicians have seen this part of your body than you have. So it's
Totally.
really important to kind of just get connected with it. It's a big step, but it's important with aging that we kind of know what our bodies are, how our bodies are changing.
Yeah. And is there an exercise that you think is great for everyone, like walking?
I
Like, because,
love walking.
yeah.
I do love walking. I also actually love cycling for people who have weakness because it's low impact. It's great for prolapse. It's great for postpartum. If you have pelvic floor tension, like doing a Peloton or cycling might not be the optimal thing, but I think it's a great one postpartum when people were like, I want to get back to exercise, but I'm not sure if I'm ready to run. It's a great way. For me, it like is just a mental shift. Like I could be in the worst mood and I get a good Peloton ride in and I just feel like a switch is flipped and I am relieved. But walking is excellent, yoga is excellent. But no matter what you do, it's about balance. Like if you love Pilates and or you're doing strengthening, you also have to do a little bit of stretching afterwards.
Yeah, it's the balance. And what do you do for exercise?
I play tennis twice, 2 to 3 times a week. I do a training class once a week, and I usually do a Peloton once a week.
Okay. Okay.
And it's
This is,
shifted. I used to do more yoga and running, and now that I'm older, I'm trying to do more like weights and resistance.
of course,
Of course.
exactly. I'm like, yes, because this is what we keep hearing and we need to do it. I'm like, of course, but we got to do it the right way. Anything women should know if they are in perimenopause or menopause, get the vaginal estrogen.
Vaginal estrogen, and talk with your medical provider. Menopause hormone replacement therapy is very nuanced. So again, I think it's like we can say like everybody needs testosterone or everybody needs estrogen or everybody needs progesterone. It is very nuanced what is right for people, the timing of it, the dosage. And also if they're not comfortable with it, like we could say like estrogen's fine, but if I'm not fine with it, then I need to have other options. So I think we really need to be able to meet people where they are and let them have the autonomy over their choices. We give them the information, but it's up to them to decide. I like topical estrogen vaginally because it's so local. It doesn't really get into your system in a widespread effect, but it's working mainly on what my specialty is pelvic floor health and vaginal health. So you get kind of all those benefits to good bladder health, less UTIs, more
Mm,
lubrication during sex, more collagen in the area, and you don't have to take a systemic hormone.
okay. Um, any non-negotiable habits for you?
Gosh, we've talked about a lot of them. I cross my legs sometimes too, but the biggest thing is,
I'm still crossing my
yeah, when I
legs.
sleep. So habits, I mean, going
Oh,
from the
and
start of
now
my
when
day.
I
Yeah.
sleep, I am now sleeping different. I'm like, now Sarah's coming to bed with me because now I'm not.
I'm like haunting you in your bedroom.
You're literally because I'm a stomach sleeper and I was lifting my legs up and I was like,
Yeah.
oh, keep them down, keep your legs down, and then try to fall asleep. Okay,
I
sorry.
sleep with
Tell
the
us
pillow
about
between my
sleeping. Yeah,
knees. I sleep
yeah.
with the pillow between my knees, on my side or underneath my knees, when I'm lying on my back. And I had a therapist recently who was like, there's no research behind this. But I'm like, but when you're pregnant and somebody's coming in with hip pain or they're older and they're coming with hip pain and you put a pillow between their knees and like, oh, it's better. I'm like, it's effective. So
Yes.
there's only there's no negative side effects in trying some of these things. And not doing them won't necessarily cause problems, but if you have problems, it's a great way to start addressing them.
Yeah.
So I think that's a huge one. How you're sleeping, how you're sitting, not slouching or sacral sitting. I know I do
Sarah.
it all the same. Also, not tightening your abs all the time. Like we've been in this thing
Oh,
of like pulling in and sucking in our stomachs, but everything kind of needs to be soft and relaxed as well.
yeah.
Um, and to be honest, like a non-negotiable is if you have a problem, you deserve care and get help for that. And I tell this story that, I started playing tennis 3 or 4 years ago at the age of 40. And a couple months ago, earlier in this year, I was playing tennis and it was at nighttime and I made a quick movement and I felt myself leak. And I haven't ever really had pelvic floor problems or leakage issues. And I was like, oh my gosh, I think I just peed my pants. And I had on these hot pink leggings and I was like, can you see it? Should I stop the match? Like, I don't want to move really quickly. And the whole rest of my match, I was distressed about like, can you see my wet pants and am I leaking? And I realized like this is what women are going through. When you have this problem, it's like you can't focus on anything else. And then I also realized like you have to practice what you preach. Like I'm in perimenopause, I'm doing a new sport, my hormones are changing, my muscle strength is going down. Like you have to start doing your pelvic floor regimen. And so that really made me start focusing more on my own strengthening exercises when I had kind of just been like resting on my laurels for a couple decades. And I was like, you can see that everyone can experience these changes, even, experts in the area, but we also have to care for our bodies because it won't get better by itself.
Yeah. Is there anything I didn't ask you today that you want to make sure the women take away from this conversation, Sarah?
I think the last thing is that if you are experiencing these issues, I want you to know that it is never too late to get help. I think it's really easy for us to say, like, I had my kids 10 years ago, or my C-section was 20 years ago, or I've had pain with sex for years, or I've always leaked, like, I'm just used to wearing the pads. I think that these things affect our quality of life in such a way that we don't even realize how much they're affecting us, that we don't realize, like, oh, we don't travel anymore, or we're stopping at the bathroom every hour, or we're spending this much money on incontinence pads. And we've accepted that, like, sex isn't just part of our life, which is fine. But I think we've been told for so long that we just have to deal with these, but there really are solutions available, and they're really small changes that can have a big impact on your life. And I think that we deserve that. And so I just always tell people these are great times to go, but if it's been something you've experienced for a while, it's never too late to get support.
Absolutely. I love this conversation so much. Where can I direct the ladies to find you, to find Floored? What a cool cover, by the way. A
Thank
woman's
you.
guide to pelvic floor health at every age and stage. So it's really you're right. Our girls, I have a teenager. She
Yeah, I really would have her read it. I'd have her read the first couple chapters on, like, what is the pelvic floor? What does it do? About periods, about, having sex later in life. I think that if we can really educate the next generation, then they will feel more empowered to ask the questions, to seek help, to understand their bodies and know when something's not right instead of just dealing with it silently for so long. Um,
totally.
so Floored is, available at anywhere you like to buy books. It was just newly released, and I've been really excited about the feedback from it. You can follow along. Thank
Congratulations.
you.
Well deserved.
Thank you. I'm on Instagram as the Vagina Whisperer, and then my workout platform is called the VHive, which you can find on my website, thevaginawhisperer.com.
And ladies, all of those resources are right on your podcast player, easy to find. Dr. Sarah, and go check her out. Say hello, say thank you, and I'll say thank you. This has been fantastic. This is the conversation we didn't even know we needed to be having, but thank you for the work you're doing. I mean, we really wouldn't be knowing about this stuff if you weren't
Yeah.
out there. So thank you.
Well, thank you for having me and for sharing this with your community. I'm so appreciative.
Thank you.